Hey, Dr. Frank, with another clinically relevant. This is a case study on a PT that came to one of our courses about a week or so ago. She had an 8-year history of pain with jaw dysfunction in general. This began in high school, so she went through the normal route of going into a dentist, getting a bite plate splint, and then, of course, chewing right through it. Later in her high school career, she ended up getting elbowed in the jaw, which certainly made her conditions worse. Now she had a lot more clicking, popping, and some intermittent jaw locking that went into this. And of course, some ear symptoms, which we'll talk about. So when we first looked at her, initial presentation on September 29th, she looked like this.
Where's mommy to fix this?
Yeah. So you probably can't hear it, but there's some really good crunching and grinding that's going on in this particular scenario. So what did we do with her? Well, first of all, we used single needle to each of these areas, right? We didn't do any pisting or twitching or anything like that. It was very specific, targeted needling, used a little bit of rotation to try to stimulate the nervous system like we wanted to stimulate it. But we did pterygoids. I did inferior, I did superior heads on her bilaterally, can reproduce some of her ear symptoms and underneath her eye. Medial pterygoids immediately reproduced her ear pain, right? Supraohyoids gave a nice big ache through there. Masseters, again, you can imagine from all the clenching, she's got some tone there. A little bit in the temporalis, but nothing really that significant. So I switched to auriculotemporal nerve. That immediately started her with her ear pain and TMJ pain. Afterwards, immediately after, she looked like this.
It feels straighter. Yeah.
So when we look at what she's doing, her speed is definitely better. Not only the quality of her movement, right, but the speed of movement and the quality of movement is better. That lets you know that the neuromuscular patterning is improving, right? So October 3rd now, we're about 3.5 days or so afterwards, right? She's in the car and she's got some more chopping, some weird stuff she said. So this is what she looked like and what she sent me. Good opening. And then some really weird, S-curvy kind of movement patterns there. So her neuromuscular patterning is off. Not a lot of clicking, not a lot of anterior sliding like we had saw initially, but she's been clenching still. Yeah, there's no doubt that she's still been clenching. So next day, she's going to go ahead and needle herself. Now, obviously, I showed her where to needle and how to needle, those types of things. She still needs some more practice on her medial pterygoid because she said here she still had ear pain, which had gone away, but she doesn't feel that she hit the medial pterygoid as well as she could have, so that was still there. But here's what it looked like. So she's trying hard, obviously, from an opening standpoint, but a lot of that S-curvy kind of stuff, no clicking, no popping going on. So she was quite successful in doing the needling, and she'll continue to get better with needling, right, as she practices more on herself. Now, from the clinical relevance standpoint here, when you really initially saw her, she really looked like just the disc was sitting forward and she was clicking on it, right? So again, changing the neuromuscular patterning took that away almost immediately. So not to say she doesn't have a disc problem, but restoring neuromuscular balance, muscle activation patterns around the whole complex changes those joint mechanics, that joint noise and condylar popping, right? Now, the big issue here is she's still clenching and grinding, and that's probably one of the reasons why she's losing some of the normal patterning, allowing the muscles to fire when they're supposed to, attenuate and generate force. So, does she need a splint? What I find clinically is if you restore neuromuscular balance and you maintain it, whether it's yourself with your jaw problem or your patients, right, restoring that neuromuscular pattern and keeping it that way tends to take away the need for the guards and the splints and things like that, because the jaw is in the position that it should be, right? So I think, when we look at needling, we have to be looking at it from a neurological or neuromuscular standpoint, rebalancing the structures 360 and 720 around the joints, whether it be a jaw, a knee, a shoulder, doesn't matter, right? Restoring that neuromuscular balance and doing it appropriately is the key to success. I hope you enjoyed this. We'll talk soon.